You are standing at the kitchen counter. It is a Tuesday morning. There is a loaf of bread in front of you, the one you always buy, the one that is always in the pantry, the one your kids have eaten their whole lives. You pull out 2 slices, drop them in the toaster, and wait. This is the most normal thing in the world. Bread is not a risk category. Bread is breakfast. It is sandwiches and toast, and the thing you grab when there is nothing else. Americans eat about 20 pounds of it per person per year. It is so ordinary that no one reads the label. Why would you? It is bread. I am going to ask you to read the label today. Specifically, I am going to ask you to look for 2 words, potassium bromate. And I am going to tell you exactly what those words mean, why 30 to 40 countries have removed them from their food supply entirely, and why the United States federal agency responsible for your food safety has not formally reviewed this ingredient since 1973. Before this video is over, you will know how to check for it in under 5 seconds and what to do if you find it. Potassium bromate is a flour treatment agent. It has been used in commercial baking in the United States since the early 20th century. It makes dough stronger, helps it rise higher, and produces bread with a whiter, more uniform crumb. It is cheap, effective, and still present in a significant share of commercially baked American bread products. It is also classified by the International Agency for Research on Cancer, the Cancer Research Division of the World Health Organization, as a Group 2B substance, possibly carcinogenic to humans. Animal studies have shown increased rates of kidney tumors, thyroid follicular cell tumors, and peritoneal tumors when potassium bromate is ingested over time. Multiple laboratory studies across independent research groups have confirmed genotoxicity, the ability to cause direct DNA damage, in cell and tissue models. The classification is not based on one outlier study. It is based on a consistent pattern across multiple independent lines of evidence. The European Union banned it in 1990. The United Kingdom followed, then Canada, then Brazil, China, India, South Korea, Argentina, Nigeria, more than 40 countries in total. Each of them reviewed the evidence and reached the same conclusion. The risk profile does not justify continued use in food, especially when alternatives exist that do the same job without the same concerns. The United States Food and Drug Administration has not formally reviewed potassium bromate's safety status since 1973. In 1991, the agency asked the baking industry to voluntarily phase it out. It was a request, not a requirement. 35 years later, it is still in American bread. I want to explain why a Group 2B classification deserves more attention than it typically gets in food safety conversations, because that category is frequently dismissed with the argument that everything is classified as possibly carcinogenic. Group 2B means there is limited but credible evidence of cancer risk, primarily from animal studies, with insufficient or absent controlled human trial data to establish a definitive causal link in humans. It is not the same as Group 1, which is reserved for established human carcinogens like tobacco and asbestos. It is also not the same as no evidence at all. The significant factor with potassium bromate is not the classification alone. It is 3 things together. First, the classification exists. Second, the mechanism of harm, direct DNA oxidative damage, has been confirmed in laboratory models at concentrations that overlap with estimated human exposure from normal bread consumption. Third, it is an additive with no nutritional value. It does not make bread more nutritious. It does not make it safer. It makes it look better and rise higher, which are commercial and cosmetic benefits with no direct benefit to the person eating it. When a substance has a carcinogen classification, a documented mechanism of DNA damage, and no functional benefit to the consumer, the calculus for keeping it in the food supply requires strong justification. The argument the FDA has relied on for over 50 years is the one I am going to examine closely in this video, because it is less solid than it sounds. The standard industry and regulatory defense of potassium bromate rests on a single assumption. When bread is fully baked at proper temperatures, potassium bromate converts to potassium bromide, a different compound that does not carry the same health concerns. The argument is that the finished loaf on your counter contains bromide, not bromate. If that conversion were complete and reliable, the concern would be substantially reduced. But there are 2 specific problems with this argument that neither the industry nor the FDA has satisfactorily resolved. The first problem is that residual potassium bromate has been detected in commercially produced bread products in multiple independent laboratory analyses, including testing conducted by researchers specifically looking for it in finished baked goods. The conversion to bromide is real and it does occur during baking. It is also not complete or guaranteed under the conditions of real commercial ovens. Baking temperature, time, and ingredient combinations all affect the conversion rate. When a loaf comes out of an industrial oven 30 seconds faster than the conversion chemistry requires, whatever bromate remains is in the product that reaches your table. The second problem is more fundamental. The United States FDA has not formally reviewed this additive's safety since 1973. The genotoxicity research largely did not exist in 1973. The IARC classification did not exist in 1973. The evidence base that led more than 40 countries to ban this compound did not fully exist in 1973. The FDA's current permissive stance is not based on a recent review of modern evidence. It is based on a regulatory status that was established before the relevant science existed. Here is where this becomes immediately practical, because the labeling situation with potassium bromate is its own problem, separate from the regulatory one. When potassium bromate is added directly to bread dough, it may be listed on the ingredient label as potassium bromate. Many consumers who have heard of it can find it this way. But it is also used at the flour level before the bread manufacturer ever adds ingredients. When a flour producer treats their flour with potassium bromate, the resulting product is called bromated flour. And when a bread manufacturer uses bromated flour in their recipe, the word bromate may appear on the label as bromated flour or enriched bromated flour, or it may not appear by name at all, depending on how the manufacturer describes the flour blend. The Environmental Working Group has identified more than 200 consumer products in the United States that contain potassium bromate. These include products from well-known brands sold in mainstream grocery chains. The list is not limited to cheap or obscure products. It includes items marketed as fresh, natural, or artisan adjacent. Here's the moment in this story that tells you everything about where the current regulatory situation actually stands. In 2023, California passed AB 418, which bans potassium bromate from food products sold in the state. That ban takes effect in 2027. California is the fifth largest economy in the world. When California bans a food additive, national food manufacturers face a choice: produce two separate supply chains or reformulate for the national market. History says they reformulate. In early 2026, legislation in New York to ban potassium bromate from food manufactured or sold in the state passed both chambers of the state legislature with a substantial majority. Illinois has pending legislation to ban it starting in 2027. Pennsylvania introduced similar legislation in 2025. Utah and Arizona have already banned it specifically in school food service. Something is happening at the state level that is not happening at the federal level. Legislators in multiple states, reviewing the same evidence that 40 countries reviewed before them, are reaching the same conclusion those countries reached. The federal agency responsible for national food safety has not formally updated its review of the relevant evidence since before most of the people watching this video were born. I want to say the difficult thing directly, because this channel's credibility rests on not softening what the evidence actually shows. Potassium bromate is a substance classified as a possible carcinogen by the Cancer Research Agency of the World Health Organization. It causes DNA damage in laboratory models. It has been banned in more than 40 countries. Residual levels have been found in commercially produced bread. The FDA has not reviewed it since 1973, and it is in a significant share of the bread that American families buy and eat every week, including bread fed to children. The long-term health consequence of eating bread containing trace levels of residual potassium bromate over years and decades has not been established in a controlled human study. I am not going to claim it has. What I am going to say is that the information needed to make an informed choice about this ingredient has not been made available to most Americans through any normal channel of food safety communication. It is not on warning labels. It is not part of routine nutritional discussions. It is not the kind of thing a pediatrician mentions at an annual visit. You are finding out about it here because it exists in the published literature and the regulatory record, not because anyone with authority over the food supply decided you needed to know. The practical change here is one of the simplest we have covered in this entire series. Read the ingredient list on any bread, roll, bagel, or packaged baked product you are considering. Look for the words potassium bromate or bromated flour. If either appears, put the product back. That is the complete intervention. It takes 5 seconds. Most major national bread brands have reformulated away from potassium bromate in recent years, particularly those with national distribution in markets that have already enacted or are approaching bans. Pepperidge Farm, Arnold, Nature's Own, and Dave's Killer Bread do not use it. Most organic and European-style bread products do not use it. The additive is more commonly found in flour tortillas, pizza dough products, some dinner roll products, and certain commercial baking blends. If you bake at home and buy flour, check your flour as well. Bromated flour is available in supermarkets and is used in some commercial baking blends. King Arthur flour does not use potassium bromate. Bob's Red Mill does not use it. These are not the only options, but they are easy reference points for what unbromated flour looks like on a label. The absence of potassium bromate does not require a special store, a premium price, or a fundamental change in diet. It requires reading one line of the ingredient list you are already looking at when you check for sodium or calories. Here is the piece of this story that does not make it into most coverage, and it is the one worth taking with you past this video. Potassium bromate is not the only flour treatment agent in American bread, with a complicated regulatory history. Azodicarbonamide, also known as ADA, is a dough conditioner that has been used in American bread since the 1960s. It is also banned in the European Union, the United Kingdom, and Australia. It is on the FDA's approved list in the United States. You may recognize it from 2014, when it received public attention after a food blogger pointed out that it was also used as a component in yoga mat foam and shoe sole rubber. Several major fast food chains reformulated away from it after that coverage. It remains common in packaged bread. Two different flour treatment agents, both banned in most of the developed world, both still permitted in the United States, both present in a significant share of the commercial bread supply, both with regulatory statuses that have not been comprehensively reviewed by the FDA in decades. This is not a coincidence. It reflects a regulatory framework for food additives that defaults to permissive and requires substantial external pressure before reconsideration occurs. The California and New York bans on potassium bromate are that external pressure. They are working through the system now. The reformulations they require from national manufacturers will eventually reach the national supply chain, but that process moves on a timeline of years. The 5-second label check I described moves today. It is Tuesday morning again, same kitchen, same counter, same loaf of bread. This time you flip it over. You run your eye down the ingredient list, the one you have never read before, the one that looks like a chemistry assignment. You find what you are looking for, or you do not. Either way, you now know what you are looking for and you know why. That is the entire intervention. One glance, 5 seconds. The information you needed to make it was in the regulatory record and the scientific literature the whole time. It just was not on the label. This channel exists to take the ordinary things in your kitchen and tell you what the published evidence actually says about them. Not what the label says, not what the advertisement says, what the research says, including the parts the regulatory system has not gotten around to acting on yet. If you want the next one, subscribing is how you get it. I will see you in the next